Breast cancer patients are in shock when they're diagnosed. I tell them today's the hardest day, because you just found out that you had cancer, you're overwhelmed with all of this amount of information about your treatment. And I tell them, I know it's overwhelming, but there's gonna be a point where you're gonna sit here and you're gonna be a cancer survivor. The advancements in breast cancer care are twofold. One is decreasing the risk of recurrence with treatment after surgery. And then the other side of the advancements is actually peeling back on the aggressiveness of care. For example, mastectomies. They used to be very, the radical mastectomies where they took out the muscle and everything, and now we're down to, if the tumor is small enough, we can get away with a lumpectomy, just a small portion of the breast. As it pertains to my field in particular, we used to, for instance, for patients with higher risk breast cancer, give chemotherapy to most patients. And now we've peeled back and we have more detailed, what we call precision medicine. We do genomic testing on the tumors to know, how much risk is there of this cancer coming back. And if the risk is intermediate or low, we don't need to give everybody chemotherapy. Genetic counseling is important, and it's part of the support system that we have here at Memorial as well. Breast cancer is the most common cancer in females. And although most of those cases are sporadic, meaning that they're not inherited from, family members, about 10% are genetic. And it's important to test those patients because it affects their children and when they may need to start screening. The other thing that it can affect is the patient's own treatment plan. When I meet patients at the beginning, a part of their process of being scared is the side effects of treatment. Some women will lose their hair with chemotherapy. Our Image Recovery Center helps them with wigs, bra fittings, and all that, and it helps them feel more whole throughout treatment. I like to educate my patients and feel like they're part of the process, not like they're just being told this is your treatment. I'm thorough. I like to be compassionate because I understand that being diagnosed with cancer can be a scary process. And that's part of that comfort for them, and being part of that journey with them is a big reason why I enjoy what I do. Because it's a journey. It's a journey that you go through with them.